I'm Dr. Ryan DeBell from The Movement Fix. This is Movement Fix Monday.
Movement Fix Monday.
I'm here with Dr. E from Modern Manual Therapy, Edge Tool, the Manual Therapist. What other websites do you have that I'm not saying?
UpDocMedia.com, EdgeMobilitySystem.com, Stop.viruses.com, ManualTherapist.com, PhysioAnswers.com.
A lot of websites. And we're here in Nashville because Urson's teaching his 2-day workshop and assisting. And we're also here with Dr. Mario Novo, who we've seen previously from the BFR, the blood flow restriction videos. And what we're going to look at in this video is, well, Urson, what are we going to look at in this video?
Right now we want to look at what I call the easiest knee assessment in the world. So if you're having knee issues and you've been to a very good clinician like Ryan DeBell or Mario Novo, and like many good clinicians, we tend to look up and down the chain. But sometimes a knee problem is just a knee problem. So when I reviewed research, it basically showed that some ACLs who recovered versus ACLs who did not recover, a lot of times terminal knee extension was not restored. I basically started to look at terminal knee extension, or how far someone can accept load in extension. The difference between an active and passive capacity of a joint is actively you could only move so far, but a true healthy joint passively should be able to accept a little bit more load. There should always be a little bit more mobility passively for a healthy joint. If actively and passively you're the same, even though it appears to be full range of motion, that joint is not quite as healthy as it should be. So the reason why I invited Dr. Novo back is because he had a previous knee injury on his left. He rehabbed it himself, like many of us would try to do, especially if you're a clinician. But I think he may have missed his extension. Let's just see. We haven't looked at this yet. This is the uninjured one. This was the injured one.
That's right.
You're not going to find this in anyone, but it's easy enough to have someone else quickly assess it. You can't really assess it yourself. But once someone assesses it and they reset it, it's easy enough to keep it reset on your own, so you don't need another clinician to treat you. Normally, and he already actually has, even on his knee that is not bothering him or was previously not injured, I'm not going to expect the normal 10 degrees of knee hyperextension, but what I expect of any normal knee, healthy knee, is that you should be able to, if you stabilize above here, so you should have a colleague do this. If you stabilize here, make sure you're not pushing down on the kneecap. So I'm pushing straight down toward the ground, more on the quad, okay? Not right on the kneecap, because that'd be really uncomfortable. So I'm holding the quad down. And then I expect that with a decent amount of effort, like maybe I'm lifting 10 to 20 pounds worth, I should be able to easily hyperextend that. And you can see that if I stabilize this knee comes off. Not as much as I would expect, but again, he doesn't have the ability to lie flat anatomically. He may have not done that ever, right?
You would expect what, 5 degrees?
5 to 10 degrees. He has a little bit less.
Right?
Right. So this is the previously injured knee, the one he rehabbed himself. And I would say that I can't really lift him up, like it's barely coming off the ground. I don't know if that's apparent on the camera. So how do you fix that? If he would have pain with that, or if he would say, like, it's really hurting my hamstring or something, one of my favorite things to do to just basically modulate the pain, and all I mean by modulation is when you use something like an edge mobility band or competing band and you wrap it up, it just tricks the brain into feeling the compression rather than stretch. The brain feels stretch and it thinks it's already like kind of protective about this area due to previous injury. It's not going to let that area get its full range of motion. But anytime that either you make dramatic changes in your mobility or someone else does, you had that mobility, only your brain didn't let you access it.
So you're using the band sort of like, so you feel something else.
Yes.
Besides what you normally
Besides what you would normally feel.
Right? So that's what we're assuming sort of the mechanism is while you're doing this, yeah?
Right, yes, it's basically like tricking the brain. I call it modulation, but it's an easier way.
But that's an important thing to know what you're doing, because it'll change how how you do it.
Right.
Because how tight are you wrapping it?
Basically as light as I possibly can, enough that he feels a good compression, but not so tight.
Not
it's not like BFR.
No, not BFR.
It's not BFR, and you don't have a 20 to 30 second window before your leg goes numb.
Right, you're trying to stimulate nerve endings in the skin.
Right. I've had people leave this on for entire workouts. I've left this on for an entire workout.
Oh, some people use them as knee wraps.
Yeah.
I've seen that once in a while.
I mean, most importantly though, the way you wrap this, it doesn't matter whether it's, you know, distal to proximal, proximal to distal, clockwise or counterclockwise, but the website and the logo has to be out, okay? Because you will get better results. And you stole that joke from me last week, Novo. All right, so let's see. This might make a difference, it might not. Maybe it would make it easier on me. I'm just trying to make it easier on me. But actually, that is quite a bit easier to lift your heel up off the ground, right?
Yeah.
And I'm perceiving as your clinician that it's easier on me. And I wouldn't necessarily even tell a patient that, but I would ask, say, like, how's it feel for you?
It's comfortable.
Right. So if he even had pain, and typically it could be any, it could be.
Yeah.
What's that?
I said it makes it more comfortable for him.
Yes, it makes it more comfortable for him.
Yeah.
I could get the same results without the band, but the whole purpose of the band is to make the technique more comfortable. With or without the band, because once I make the improvements, and again, this is going to help anything from a squat to running to box jumps, to anything
that involves the knee.
Anything that involves the knee and loading the knee.
Yeah.
Because people always are like, oh, I have pain with knee flexion. I got to work somehow. I got to do some sort of technique that's going to improve knee flexion, but no one ever works on knee extension.
Right. You have to think about the joint. It goes. You have to look at the whole range, right?
Right.
Just because
you have full flexion doesn't mean that flexion is going to be threat free.
Right.
So it's just it's a missing component. People don't really look at terminal extension. They think, oh, I can lie flat. It's fine. But the knee doesn't have full capacity.
Got it. Yep.
Okay. So self-reset, he can leave the band on, he can take it off.
Right. What does he do on his own, right? Obviously, you're not going to be around to pull on the
right.
leg every day.
I am not going to be around, and my goal as a clinician is to get you not needing me. Okay, so let's unwrap this. You want to unwrap that real quick? edgemobilitysystem.com. All right, so easy enough thing. You just got to, anytime you do a reset like this, you make a dramatic change in range of motion. I mean, that's dramatic in terms of the amount of hyperextension we saw, because you're only supposed to have between 5 and 10. But it ended up being easier than your one that wasn't you.
Yeah.
I still put more effort into that one. So you're just gonna do the same thing. It's gonna look, I'm not really stretching the hamstring, because I've shown these videos on Instagram and stuff before, and people are like, you're just doing a hamstring stretch. I'm not doing a hamstring stretch. Because I'm not leaning forward to feel tension in my posterior chain. So again, you put your hands like this, above your kneecap, not on your kneecap. So more on your quad, and just drive down toward the ground. Not straight down, more like, perpendicular to your leg. And just hold for a second. I would say you do 10 of these an hour. What's 10 an hour mean? Basically, anytime someone resets your system and you get increase in range of motion, you're going to have like this window of improvements. Then that window is going to close. If he's had loss, oh yeah, nice. You can definitely extend that one more.
Yep.
You should probably do that to this one too. If you kept this, or if I restored it, it's up to you to keep it. The brain tends to be, yeah, the brain tends to be protective, and it's just doing its job. But he will lose that range of motion. He doesn't reinforce it. It's just kind of, and anyone who's athletic, it's like just make this part of your training program, right? And dosing is really important. Just like dosing of hypertrophy or endurance training. If you don't do it enough, it's not going to make a difference.
No, and that was pretty easy to apply. I mean, I can totally see myself physically putting something like that together before I get, ready to actually work out.
Right,
so,
right.
I mean,
Part of your prep,
right off the bat, interesting. And I'm not even having to flex my quads to get to end range, whereas here, I'm going to have to actually pull myself into end range, and I can really feel the difference. It actually feels a lot lighter, right, to move into that position, and it's not uncomfortable at all.
There's also like performance benefits to that too. I mean, think about the lifts where you need that. If you think about
triple extension, you get
triple extension, any sort of Olympic lift, kettlebell swing. If you can't fully extend your knee,
the motion is going to come from someplace else.
Well, that's going to be an issue, yeah. I mean, maybe that's why something else is bothering you, etc. And also, as you said, perhaps that helps knee function in the other directions besides just the one you restored.
Right.
Which is
I'm not
important.
doing it just to restore extension. I'm doing it to make the knee overall healthier to be able to accept load.
Right, because if you have a missing range of motion of a joint, that whole joint isn't going to work as well as it could if you have full range of motion in all directions, right? So, yeah, do you guys have anything else to add to that? Or?
No, I'm also on Facebook Modern Manual Therapy, Facebook, Instagram, follow me. I've always wanted to be on a Move and Fix Monday. I'm so happy.
Here we are. Anyways, that's what we got for you guys this week. You can also, if you don't follow the Move and Fix on Instagram, make sure to find me at the Move and Fix. You can also find Mario at Lifters Clinic. Thank you guys for joining me. Thank you, Dr. E, for sharing your what'd you call it? The easiest knee assessment ever?
Easiest knee assessment ever.
Easiest knee assessment ever. Definitely something that, if you're a clinician, to make sure you're looking at that passive end range extension. And I'm sure people out there are going to be cranking on their knees. So obviously, if you have knee pain, get it looked at. But if you need to restore this range of motion, it's certainly a way to look at it. So anyways, that's what we got for you guys. We'll see you next week.